All right, welcome back, everybody. President Trump holding a news conference late yesterday to calm Americans' fears about the risk of coronavirus hitting the United States.
I don't think it's inevitable. I think that we're doing a really good job in terms of maintaining borders, in terms of letting people in terms of checking people. And also, that's one of the reasons I'm here today, getting the word out so people they'll know. They're going to know. No, I don't think it's inevitable. I think that there's a chance that it could get worse. There's a chance it could get fairly substantially worse, but nothing's inevitable.
For more on the president's response to coronavirus fears, let's bring in our guest, Dr. Scott Gottlieb. He is the former FDA commissioner and CNBC contributor. He also serves on both Pfizer and Illumina's boards. And Scott, it's really good to have you here today. Thanks. Thank you. How should we be looking at this? How are you looking at this?
Well, I think we're entering a new phase. I think we're going to have community transmission in the United States. We already do. There's probably cases in major cities, dozens, maybe hundreds, certainly not thousands at this point, and we'd be seeing that. But the California case demonstrates that there's community transmission. An epidemic isn't inevitable, but we need to start taking concerted actions right now. We need to crash development of therapeutics and a vaccine. We need to dramatically broaden screening, and people need to start getting prudent. Simple changes in behavior can have a very big impact when distributed over a large population. Hand washing, staying home when you're sick, workplaces changing practices. We might need to start engaging in broader mitigation steps to, engage in social distancing and other things like that.
When you say workplaces changing, what do they need to do?
Well, I think you need to start thinking about flexibility for employees. If employees are sick, how they can stay home, how you can support employees with things like daycare and other things that can keep them out of the workplace if they're sick. We need to start thinking about if we're going to have to change practices to limit social contact, cancel large meetings, limit travel. We're not there yet, but those are the kinds of things that you would need to do to prevent an epidemic spread. We will have outbreaks here in the United States. It's inevitable, but we do not need to have an epidemic here. We can't avoid that.
When you sat down at the table, you pulled Purell out of your pocket and actually did this to your hands. What does that do in terms of improving your chances of not getting sick?
Well, look, I think a lot of the transfer, people worry about aerosol, but there's a certain amount of things that we can't do to prevent that. I think a lot of the transfer of this is probably touching and in touching your face. Mm-hmm. So if you're on a plane, it's not the air on the plane, it's someone passing out cups on the plane to all the airline passengers.
But I thought that Purell didn't kill viruses. It killed bacteria.
It kills the virus. This is a coronavirus. It appears that this virus lives on surfaces for a period of time, but it's not a hardy virus. So alcohol wipes,
I've been saying shaking hands is a barbaric thing to do.
Yeah. Are you doing that right now? Are you shaking hands with anybody, or?
I've been trying to avoid it. I mean, I think simple changes in behavior and you distribute them over a large population can have a very big impact, and we need to start thinking about implementing those behavior changes now. And also good infection control in hospitals. Doctors in the United States practice very good infection control, but we're going to need to step it up.
You don't agree?
I don't agree with using the word barbaric. I think that at a point like this, it's a good idea not to. But I think if you weren't worried about it, it's a human thing to do to look someone in the eye and shake their hand. I don't think it's barbaric.
But right now
that's all I'm saying.
Right now
barbaric? What is that?
There was a study that showed that a fist bump cut transfer by 90%.
Yes.
All right. What about the fist bump?
That's what you said.
Fist bump.
Cuts it by 90%.
So there's no germs here?
It can cut transfer. In all seriousness, I think the backstop, we have to prepare that this is not something that's going to start and stop. This could become something that we have to live with, and what's going to inevitably be a backstop against it's going to be a therapeutic or a vaccine. We need to invest very heavily in that right now.
We might have a therapeutic already, theoretically. We're not going to have a vaccine for at least a year and a half.
A vaccine's a long way off.
So why not focus on something that lessens the severity of
and remdesivir looks promising, and it could be here.
Is that a Gilead drug?
That's Gilead, and also an antibody-based prophylaxis like what Regeneron's working on. Those things could be nearer-term opportunities, something we maybe even could have in the late fall or early winter.
Therapeutically, what about a protease inhibitor? We have stuff already that might...
Those look less efficacious in the in vitro studies. We haven't done good clinical studies.
What do we need to do to make sure you don't immediately prescribe a steroid, a prednisone or something, and then cause an immune response that kills you? Because that's what kills the young people, right? Isn't it a cytokine storm?
It looks like it's a cytokine storm, and it looks like it's more of an ARDS, acute respiratory distress syndrome type picture, and it looks like steroids aren't effective. They were giving steroids to those patients when they were hospitalized in China. It looked to be not effective and not a recommendation.
It could be counterproductive.
Could it actually make it worse?
It potentially could. I mean, the problem is that once that process ensues and you have a very high viral load, simply killing the virus at that point may not provide therapeutic benefit. It might actually worsen. And that's what we're going to find out from the studies that are ongoing in China. But I think we need a moonshot approach right now. We have the ability to conquer this with science. The science is there. It's available. Regeneron was able to develop prophylactic antibodies to Ebola, and they had one in the lab for MERS. These things are obtainable, and that's what we should be focused on.
Isn't it?
It's not a year and a half.
It's not for phase 1 and phase 2?
With H1N1, the swine flu in 2009, the first case was identified, I think, April 15, 2009. Yep. By September, we had a vaccine.
Okay.
This is possible, and that's what we need to focus on.
How much money? We're almost out of time, but how much money that
I think we should put billions of dollars. This is not the time to be a fiscal conservative.
Okay. Where are you on that question of the weather, the time of year, whether this dies out when we get
the summer should be a backstop, but it might not stop transfer entirely because this is a very novel virus where we don't have cross immunity. It should be a backstop. So you could see this dissipate in the summer and then come back in the fall, but by the fall we'll have a therapeutic hope.
Yeah, no, I've seen lots of questions on the other side.
Dr. Gottlieb, I want to thank you for being with us.
Thanks a lot.
Great to see you.